Today we're going to cover sexually transmitted infections, or STIs. So what we're going to talk about today are the major STIs, the most common ones, and what you can do about them. So STI stands for sexually transmitted infection or sexually transmitted disease. And these are diseases that can be transmitted by sexual contact. Some can also be transmitted by other means. So the following 7 STIs pose major health threats, especially in the United States. Okay? These STIs can cause serious complications if left untreated, and they also pose a risk to fetuses and newborns. So we have HIV and AIDS, chlamydia, gonorrhea, human papillomavirus or HPV, herpes, hepatitis, and syphilis. The United States has one of the highest rates of STIs of any industrialized nation. In 2013, this was quite a few years ago, the CDC estimated that 110 million Americans had an STI that year. Here we have a graph or a chart of annual new cases of STIs in the United States. So this is saying that every year, let me get my pen, there are 14 million new cases of HPV, almost 3 million new cases of chlamydia, and so on. STIs and sexual anatomy. The symptoms and outcomes of STIs vary between sexes. So women are harder hit by STIs because of biological reasons and social reasons. Here we have a figure of the male sexual anatomy. So if you're not familiar with any of this, I would recommend just taking a second to become familiar, right? We should be aware of our own anatomy and we should be aware of others. So here we have the bladder, right, which we're probably usually familiar with. This is where our urine is collected, and you can see that it comes out through here. Okay, so that's how urine leaves the body. Then we have the rectum, okay, the anus. Here we have a pubic bone. And then here we have the vas deferens. So this is very important for knowing how a vasectomy works or how sperm leaves the body. So sperm is created in the testes, right? And it travels through the vas deferens in order to leave. Okay? So it goes up this entire trail and leaves the same area as urine. We also have the penis, which you're probably familiar with, the urethra, which is where urine leaves. We have glands, as well as your prostate. Those are probably the most important areas to be aware of. Then we have the female sexual anatomy. So similar to before, here we have the bladder and how it leaves, the urethra. And then we have the anus, the rectum, and then we have the vagina. Okay. Now keep note that the vagina is actually referring to the internal section. Okay. The outside, the opening, is not technically not called the vagina. It's called the vulva. Okay. And then we have the clitoris, pubic bone, fallopian tubes, and ovaries, where our eggs are stored. HIV infection and AIDS. So HIV stands for human immunodeficiency virus, and it is a virus that causes HIV infection and AIDS. AIDS stands for acquired immunodeficiency syndrome, and it's generally fatal, it's incurable, and it's a sexually transmitted viral disease. So an estimated 78 million people have been infected worldwide since the epidemic began in 1981. And in the US, nearly 1.2 million people are currently living with an HIV infection. So what is HIV? HIV infection is a chronic disease, meaning it gets worse over time, and progressive, also gets worse over time, that damages the immune system. It makes an otherwise healthy person less able to resist a variety of infections and disorders. So normally when a virus or other pathogen enters the body, it is targeted and destroyed by the immune system. But HIV attacks the immune system itself, taking over immune system cells and forcing them to produce new copies of HIV. It also makes them incapable of performing their immune functions. So the destruction of the immune system is signaled by loss of CD4 T cells. As the number of CD4 T cells declines, an infected person may begin to experience mild to moderately severe symptoms. And a person is diagnosed with AIDS when he or she develops one of the conditions defined as a marker for AIDS, or when the number of CD4 T cells in the blood drops below a certain level. And people with AIDS are vulnerable to a number of serious, often fatal, secondary or opportunistic infections. So opportunistic infections occur when your immune system is already so low that you're just more likely to get other infections that you would normally fight off. So the asymptomatic, meaning you don't have any symptoms, or incubation period of HIV, the time between the initial viral infection and the onset of the disease symptoms may range from months to 20 years. Okay, so you could have HIV and not know it for months to years. Okay. And there's an average of 11 years in untreated adults. Okay, so it can take someone on average 11 years to realize they have HIV or to show symptoms. Most infected people experience flu-like symptoms shortly after the initial infection, but most regain general health for years. So during this time, the virus is progressively infecting and destroying cells of the immune system, and people infected can pass the virus to others even if they have no symptoms, okay? This is why it's really important to get tested regularly. So HIV lives only within cells and body fluids, not outside the body. So it's transmitted by blood and blood products, semen, vaginal and cervical secretions, and breast milk. It cannot live in air, water, or saliva, or on objects or surfaces such as toilet seats, eating utensils, or telephones. So a person is not at risk of getting HIV if you're in the same classroom, dining room, or even household of someone who is infected. There are three main routes of HIV transmission: specific kinds of sexual contact, direct exposure to infected blood, and contact between an HIV-infected woman and her child during pregnancy, childbirth, or breastfeeding. So during sexual contact, HIV is more likely to be transmitted through unprotected vaginal or anal intercourse than by any other sexual activities. So during vaginal intercourse, male to female transmission is more likely to occur than female to male transmission, meaning men that have HIV or are HIV positive are more likely to give it to somebody than they are to receive it. Okay? So that's important in knowing if you should be taking PrEP or PEP or to get tested regularly. HIV has been found in pre-ejaculatory fluid, so transmission can occur before ejaculation. Any trauma or irritation of tissues, such as those that can occur through rough or unwanted intercourse or through the overuse of spermicides, increases the risk of HIV transmission. So the presence of any lesions or blisters or cuts can make it easier for the virus to be passed. Oral genital contact carries some risk of transmission, although less than vaginal or anal intercourse. The risk of HIV transmission during oral sex increases if a participant has oral sores or even poor oral hygiene. So some evidence suggests that drinking alcohol before oral sex may make the cells that line the mouth more susceptible to HIV infection. Although the majority of HIV infection cases worldwide result from heterosexual contact, the most common means of HIV exposure among Americans is sexual activity between men. So this is an important note. So most people think that AIDS is a disease that is contracted by men that have sex with men. That's it, right? But actually, most cases of HIV occur in heterosexual people, people that have sex with the opposite gender. Okay. But in America, it is most likely between men that have sex with men. And again, remember that's abbreviated MSM. Heterosexual contact and injection drug use, or IDU, are the next most common means of exposure in the United States. So number one is men that have sex with men, then heterosexual, and injection drug use. Getting in contact with infected blood. So needles are used to inject drugs like heroin, cocaine, or anabolic steroids, and are contaminated with the user's blood. If needles are shared, small amounts of one person's blood are injected into another person's bloodstream. About 6 to 9% of all new U.S. cases of HIV are caused through sharing of drug injection equipment contaminated with HIV. So HIV can be transmitted through subcutaneous or intramuscular injection as well, from needles or blades used in acupuncture, tattooing, ritual scarring, and piercing of any body part. Next, we have contact between mother and child. So the final major route of HIV transmission is mother to child, also called vertical or perinatal transmission, and this can occur during pregnancy, childbirth, or breastfeeding. So the number of new HIV/AIDS cases among American infants has declined more than 90% since 1992 because of testing and treatment of infected women with anti-HIV drugs. The treatment is expensive, however, and vertical transmission continues to be a major threat worldwide. Cesarean deliveries, or C-sections, further reduce the risk of HIV transmission in women with high blood levels of HIV. So here we have an image of the routes of HIV transmission among Americans newly diagnosed with HIV in 2015. And again, you can see that 67% is men that have sex with men. A quarter is through heterosexual couples. And then we have injection drug users at 6%. And then at 3%, we have both men that have sex with men who also take injection drugs. Symptoms of HIV. So within a few days or weeks of infection, some people experience flu-like symptoms like a fever, fatigue, rashes, headache, swollen lymph nodes, body aches, night sweats, sore throat, nausea, and mouth ulcers. Again, these are very similar to symptoms from common viral illnesses, so HIV infection often goes undiagnosed. As I said earlier, HIV weakens the immune system, so they're highly susceptible to other infections. So infections that are rare among healthy people, such as, I can't say this very well, but pneumocystis, pneumonia, or Kaposi sarcoma occur frequently among those with HIV. Stubborn yeast infections are also common in HIV-infected women, and tuberculosis has increasingly been reported. So in order to diagnose HIV, there are 3 tests available. The first one is an HIV antibody test. And this is performed on blood or oral fluids and checks whether the body is producing antibodies against the HIV virus. These tests usually detect infection within 3 to 12 weeks after exposure. Next is a combination of HIV antigen and antibody test. And these look for both antibodies for an HIV antigen known as P24. And because the antigen is produced before antibodies develop, combination blood tests can detect HIV earlier in the course of infection, usually 2 to 6 weeks after exposure. Next one is nucleic acid tests, and these test directly for HIV RNA in the blood and can usually detect HIV within 1 to 4 weeks after infection. And this one is expensive and it's not usually used. So depending on when you get tested, 1 or more types of tests may be available. A positive result is always confirmed with follow-up tests because it takes time for HIV RNA, antigens, and antibodies to become detectable. It is important to consider the timing of testing. The window period, or the time between infection and when a test can actually report it, varies with the type of test and with the individual. So if you get an HIV test within 3 months of a potential HIV exposure, and the result is negative, you should get tested again in 3 months. Okay, so if you participate in risky sexual activity or you find out your partner is HIV positive, you should get tested. If it's negative, you should get tested again in 3 months. If a person is diagnosed as HIV positive, the next step is to determine the severity of the disease to plan appropriate treatment. The infection can be monitored by tracking the amount of virus in the body or the viral load through a test that measures the amount of HIV RNA in blood sample tests. Although there is no known cure for HIV, there are medications that can significantly alter the course of the disease and extend life. And there are multiple types of antiviral drugs used. Now, the cost of the treatment is an area of major concern. So there are more than 30 drugs available now to treat it, including 2 once-a-day tablets, which are pretty common. So the best hope for stopping the spread of HIV is a safe, effective, and inexpensive vaccine. Although AIDS is currently incurable, it is preventable. So preventing should always be the first choice of action. So we have some different approaches to prevent, which include abstinence, of course, consistent condom use with all sexual acts, and needle exchange programs for persons who use intravenous drugs. And we're going to look at needle exchange programs for our homework assignment. Now, the FDA has approved a drug to be taken by people who do not have HIV but are at high risk for it, and this is called pre-exposure prophylaxis, or PrEP. So this means that it is a prevention method intended to be used with other methods for reducing HIV risk. So it's analogous to a birth control, so you would take it in order to reduce the risk of contracting HIV. So anal and vaginal intercourse are the sexual activities associated with the highest risk of HIV infections. So if you have intercourse, always use a condom. The use of lubricated condoms reduce the risk of transmitting HIV during all forms of intercourse. Condoms aren't perfect though, and they do not provide risk-free sex. However, when used properly, they provide a high level of protection against HIV and other STIs. Now, other devices such as latex squares, which can be known as dental dams, or devices that could be used as barriers during oral genital or oral anal sexual contact are also really important. So what's risky and what's not? Approximate relative risk of HIV transmission of various sexual activities. So you can see at the highest risk is unprotected anal sex. This means that it is the riskiest sexual behavior, especially for the receptive partner. Okay. Now the next least risky thing is unprotected vaginal intercourse, and then oral sex, sharing of toys, using a condom, hand genital contact, and deep kissing. So these are less risky but could still theoretically transmit HIV. Sex with only one uninfected and totally faithful partner. Activities that don't involve the exchange of body fluids carry no risk, like hugging, massage, closed mouth kissing, masturbation, phone sex, and fantasy. And then, of course, the only thing that's without risk is abstinence. So the higher you go on the scale, the more likely you are to contract HIV. Now, the first STI we're going to talk about outside of HIV is chlamydia. So this is an STI transmitted by the pathogenic bacterium chlamydia, let's mess this up together, trachomatis. So if left untreated, chlamydia can lead to pelvic inflammatory disease, which we'll get to later. But chlamydia is the most prevalent bacterial STI in the United States, and according to the CDC, about 2.8 million new chlamydia infections occur each year. Half of them go undiagnosed and untreated. For women, the highest rates of infection occur among 15 to 24-year-olds. For men, the highest rates occur among 20 to 24-year-olds. So all college-aged students are in there. Black men and women have chlamydia infection rates nearly 6 times higher than that of white men and women. And we're going to talk about that more next week. So both men and women are susceptible to chlamydia, but women bear the greater burden because of possible complications and consequences of the disease. If left untreated, it can lead to PID, a serious infection that can cause infertility. And again, we'll talk about that later. Chlamydia can also lead to infertility in men, although it's not as often as in women. In men under 35, chlamydia is the most common cause of epididymitis, an inflammation of sperm-carrying ducts. In men, up to half of all cases of urethritis, inflammation of the urethra, are caused by chlamydia. So some of the symptoms. Most people experience few or no symptoms from chlamydia infection. So it's sometimes called the secret killer because you don't realize you have it. So this increases the likelihood that they will inadvertently spread the infection to their partners. In men, symptoms can include painful urination, a watery discharge from the penis, and sometimes pain around the testicles. Women may notice an increased vaginal discharge, burning with urination, pain or bleeding with intercourse, and lower abdominal pain. Because infection rates are high and most women are asymptomatic, meaning they don't have symptoms, annual screening is recommended for sexually active women. Diagnosis and treatment. Chlamydia is diagnosed through a urine test or laboratory examination of fluid from the urethra or cervix. After chlamydia has been diagnosed, the infected person and his or her partner are given antibiotics, which can cure chlamydia in a single dose. It is important for the infected person's partner to be tested and treated as well. If a one-dose treatment is used, couples should wait 7 days after taking their medication to resume sexual activity. The CDC now recommends that women and men who have been treated for chlamydia be retested 3 months after treatment is completed. Okay, so although chlamydia is very common, it's the most common one, it is really simple to treat. Okay, but as soon as you're recognizing symptoms, you need to go get checked. And if you're sexually active, again, I recommend that you go get checked regularly, okay, because it is often asymptomatic. Next, we have gonorrhea. So gonorrhea is also caused by a bacteria, and it has the highest cases in 15 to 24-year-olds, similar to chlamydia. If left untreated, gonorrhea can cause PID in women and other conditions in men. During birth, infants of infected mothers can also contract an eye infection that can lead to blindness. If not, in males, the incubation period for gonorrhea is brief, generally 2 to 7 days. So that means once you're exposed to it, you develop symptoms pretty quickly. The first symptoms are due to urethritis, which causes urinary discomfort and a thick yellowish white or yellowish green discharge from the penis. The lips of the urethral opening may become inflamed and swollen. In some cases, the lymph glands in the groin become enlarged and swollen. Many males have very minor symptoms or none at all. Most females with gonorrhea are asymptomatic. Those who have symptoms often experience urinary pains, increased vaginal discharge, and severe menstrual cramps. Women may also develop painful abscesses in the glands, a pair of glands located on either side of the opening of the vagina. Up to 40% of women with untreated gonorrhea develop PID. Gonorrhea can also infect the throat of people who engage in oral sex or the rectum of people who engage in anal sex. Gonorrhea symptoms in the throat may be a sore throat or pus on the tonsils, and those in the rectum may be pus or blood in the feces or rectal pain and itching. Several tests, including gram stain, detection of bacterial genes or DNA or culture, are available to detect gonorrhea. The physician may also collect samples of urine or vaginal, cervical, urethral, throat, or rectal fluids. Antibiotics can cure gonorrhea, but increasing drug resistance is a major concern. Today, only one class of antibiotics remain consistently effective against gonorrhea. So people with gonorrhea also often have chlamydia, requiring additional antibiotics to treat that infection. Next is pelvic inflammatory disease, or PID. So this is a major complication in 10 to 40% of women who have been infected with either chlamydia or gonorrhea and have not received treatment. PID occurs when the initial infection travels upward, often along with other bacteria, beyond the cervix and into the uterus, oviducts, ovaries, and pelvic cavity. PID is often serious enough to require hospitalization and sometimes even surgery. If it's treated successfully, about a quarter of the affected women will have long-term problems, such as continuing susceptibility to infection, ectopic pregnancy, which is when an egg implants outside of the uterus in an incorrect location, infertility, and also chronic pelvic pain. It's the leading cause of infertility in young women, and an estimated 2.5 million American women ages 18 to 44 have been diagnosed. Symptoms of PID vary greatly. Some women, especially those with PID from chlamydia, may be asymptomatic. Others may feel very ill with abdominal pain, fever, chills, nausea, and vomiting. Early symptoms are essentially the same as those described for chlamydia and gonorrhea. Symptoms often begin or worsen during or soon after a woman's menstrual period. Many women have abdominal vaginal bleeding, either bleeding between periods or heavy and painful menstrual bleeding. Diagnosis of PID is made on the basis of symptoms, physical examination, ultrasound, and laboratory tests. A laparoscopy may be used to confirm the diagnosis and obtain material for cultures. Treatment should begin as quickly as possible to minimize damage to the reproductive organs. Antibiotics are usually started immediately. In severe cases, the woman may be hospitalized and antibiotics given intravenously. It's especially important that an infected woman's partner be treated. As many as 60% of the male contacts of women with PID are infected, but also asymptomatic. Next, we have human papillomavirus, or HPV. So this is an infection that causes several human diseases, including common warts, genital warts, and genital cancers. HPV also causes virtually all cervical cancers, as well as anal, penile, vulvar, vaginal, and some forms of oropharyngeal cancers. Genital HPV is usually spread through sexual activity, including oral sex. HPV is the most common STI in the United States, and 80% of sexually active people are infected at some point in their lives. The body clears the infection within 2 years in most cases, but in others, infection persists. It's estimated that 42% of adults aged 18 to 59 have active genital HPV infections, and 7 have active oral HPV infections. So a person with an active infection, even if you don't have symptoms, can transmit the virus to a partner. It's especially common in young people with some of the highest infection rates among college students. Infection with a high-risk HPV strain, if it persists, can cause cancer. So HPV vaccinations can prevent most HPV-linked cancers from occurring. These vaccines have been approved since 2006, but as of 2017, only one was being used, and that's Gardasil. So this protects against HPV types that cause genital warts, as well as those that cause many cancers. And the CDC recommends routine vaccines to be given for all boys and girls at age 11 and 12, although the vaccine can be given as early as age 9. So the vaccine is not effective when given before exposure to genital HPV, and this virus is so common that many young people will be exposed to it shortly after becoming sexually active. Vaccination is recommended for women until the age of 26, and for men till the age of 21. HPV-infected tissue often appears to be normal. It may look like anything from a small bump on the skin to a large warty growth. Untreated warts can grow together to form a cauliflower-like mass. In males, they appear on the penis and often involve the urethra, appearing first at the opening and then spreading inside. The growths may cause irritation and bleeding, leading to painful urination and urethral discharge. Warts may also appear around the anus or within the rectum. In women, warts may appear on the labia or vulva and may spread to the perineum, the area between the vagina and the anus. If warts occur only on the cervix, the woman will generally have no symptoms or awareness that she has HPV. The incubation period ranges from 1 month to 2 years from the time of contact. So people can be infected and be capable of transmitting it to their sexual partners without having any symptoms. Genital warts are usually diagnosed based on the appearance of the lesions. Frequently, HPV infection of the cervix is detected on routine Pap smears. Treatment of genital warts focus on reducing the number and the size of the warts. The currently available treatments do not eradicate HPV infection. Warts may be removed by cryosurgery, which is freezing, burning, or laser surgery. Direct applications of cytotoxic acid may be used, and there are treatments that patients can use at home. So even after treatment and the disappearance of visible warts, the individual may continue to carry HPV in healthy-looking tissue, and you can still infect other people. Anyone who has ever had HPV should inform all partners. Condoms should be used even though they don't provide total protection. Next, we have genital herpes. So genital herpes affects about 1 in 6 adults in the United States, and there are 2 types of herpes. We have HSV1 and HSV2. Many people wrongly assume that they are unlikely to pick up an STI if they limit their sexual activity to oral sex, but this is not true, particularly in the case of genital herpes. HSV can also cause rectal lesions, usually transmitted through anal sex. Infection with HSV is generally lifelong. After infection, the virus lies dormant in nerve cells and can reactivate at any time. So HSV1 is so common that 50 to 80% of adults have antibodies to it. Exposure typically occurs during childhood and during adolescence. HSV2 is almost always sexually transmitted, including during oral sex. The infection spreads readily when people have had active sores or are completely asymptomatic. So if you've ever had an outbreak of genital herpes, you should consider yourself always contagious and inform your partners. Avoid intimate contact when any sores are present, and use condoms during all sexual contact, including when you have no symptoms. One study even showed that using condoms for every active intercourse results in a 30% decrease in the transmission of herpes compared to no condom use. Newborns can occasionally be infected with HSV, usually during passage through the birth canal of an infected mother. Without treatment, 65% of newborns with HSV will die, and most who survive will have some degree of brain damage. Pregnant women who have ever been exposed to genital herpes should inform their physician so that appropriate precautions can be taken. Most people who are infected with HSV have no symptoms. Those who develop symptoms often first notice them within 2 to 20 days of having sex with an infected partner. The first episode is usually like a flu-like symptom in addition to genital lesions. The lesions usually heal within 3 weeks, but the virus remains alive in inactive state in nerve cells. Outbreaks can be triggered by stress, illness, fatigue, sun exposure, sexual intercourse, and menstruation. Genital herpes can be diagnosed on the basis of symptoms. A sample of fluid from the lesions may also be sent to a lab. Several blood tests can detect the presence of antibodies in the blood and may alert many asymptomatic people to the fact that they are infected. There is no cure for herpes. Once infected, a person carries the virus for life. Antiviral drugs can be taken at the beginning of an outbreak to shorten the severity and duration of symptoms. Currently, there is no vaccine to prevent herpes infection, but research is ongoing. Hepatitis B. Hepatitis B is the inflammation of the liver and can cause serious and sometimes permanent damage to the liver, which can result in death in severe cases. It can be caused by infection, drugs, or toxins. Some forms of infectious hepatitis can be transmitted sexually. So out of the many types of hepatitis, hepatitis B is somewhat similar to HIV, but is much more contagious than HIV, and it can be also spread through non-sexual close contact. HBV is found in all body fluids, including blood and blood products, semen, saliva, urine, and vaginal secretions. It is easily transmitted through any sexual activity that involves exchange of body fluids, the use of contaminated needles, and any blood-to-blood contact, including the use of contaminated razor blades, toothbrushes, and eating utensils. Note that HBV is not usually spread by hugging, coughing, food or water, sharing eating utensils or drinking glasses, or casual contact. The primary risk factor for acquiring hepatitis B is sexual exposure and injection drug use, and having multiple partners also greatly increases the risk. Many people with HBV never develop symptoms. They have what is known as a silent infection. The normal incubation period is 30 to 180 days, and mild cases of hepatitis cause flu-like symptoms. As the illness progresses, there may be nausea, vomiting, dark-colored urine, abdominal pain, and jaundice may occur. People with hepatitis B sometimes recover completely, but they can also become chronic carriers of the virus, capable of infecting other people for the rest of their lives. Some chronic carriers remain asymptomatic, while others develop chronic liver disease. Chronic hepatitis can cause cirrhosis, liver failure, and a deadly form of liver cancer. In 2014, approximately 1,800 Americans died from hepatitis B. Worldwide, the annual death toll from hepatitis B is almost 800,000. Blood tests can diagnose hepatitis by analyzing liver function and detecting the infecting organism. There is no cure for hepatitis B and no specific treatment for acute infections. Antiviral drugs and immune system modulators may be used for chronic HBV infection to help delay or reverse liver damage. The vaccine for hepatitis B is safe and effective. Immunization is recommended for everyone under the age of 19 and for all adults at increased risk, including people who have more than one sexual partner in 6 months, men who have sex with men, those who inject drugs, and healthcare workers who are exposed to blood and body fluids. Next is syphilis. Syphilis is a sexually transmitted disease caused by bacteria, and it was once caused death and disability for millions of people, but it can now be treated effectively with antibiotics. Rates in the United States had a low in 2001, but have increased steadily since then. In 2015, nearly 24,000 new cases of primary and secondary syphilis were reported in the United States. Syphilis requires warmth and moisture to survive, and it dies very quickly outside of the human body. The bacterium passes through any break or opening in the skin or mucous membranes and can be transmitted by kissing, vaginal or anal intercourse, or oral genital contact. Syphilis progresses through several stages. Primary syphilis, or the first stage, is characterized by an ulcer called a canker that appears within about 10 to 90 days after exposure. The canker is usually found at the site where the organism entered the body, such as the genital area, but it may also appear in other sites such as the mouth, breast, or fingers. Cankers contain large number of bacteria and make the disease highly contagious when present. They are often painless and typically heal on their own within a few weeks. If the disease is not treated during the primary stage, about a third of infected individuals progress to the chronic stages of infection. Secondary syphilis is usually marked by mild flu-like symptoms and a rash that appears 3 to 6 weeks after the canker. The rash may cover the entire body or only a few areas, but the palms of the hands and the soles of the feet are usually involved. Areas of the skin affected by the rash are highly contagious, but usually heal within several weeks or months. If the disease still remains untreated, the symptoms of secondary syphilis may recur over a period of several years. Affected individuals may then lapse into asymptomatic latent stages where they experience no further consequences. However, in about 15% of the cases of untreated syphilis, the individual develops late or tertiary syphilis. These symptoms can appear 10 to 20 years after infection. Late syphilis can damage many organs of the body, brain, nerves, eyes, heart, blood vessel, liver, bones, and joints, possibly causing severe dementia, cardiovascular damage, blindness, or death. Neurosyphilis, syphilis that invades the nervous system, can occur at any stage of the infection. Symptoms may include headaches, vision or hearing loss, alterations in behavior, and disorders of movement. In infected pregnant women, syphilis can cross the placenta. So if the mother is not treated, the probable result is stillbirth, prematurity, or congenital deformity. In some cases, the infant is born infected and requires treatment. Syphilis is diagnosed by examination of the infected tissues and with blood tests. All stages can be treated with antibiotics, but damage from late syphilis can be permanent. Other STIs. A few other infections are transmitted sexually, but can be avoided by observing responsible sexual behavior. Trichomoniasis, often called trich, is the most prevalent non-viral STI in the United States, and it's estimated to affect about 4 million individuals. The single-cell organism that causes trich thrives in warm, moist conditions, making women particularly susceptible to the infections in the vagina. Women who become symptomatic with trich develop a yellow, greenish, diffuse, or foul-smelling vaginal discharge and severe itching and vulvar irritation. Men may develop inflammation of the urethra or prostate. Prompt treatment with oral medication is important because studies suggest that trich may increase the risk of HIV transmission and, in pregnant women, premature delivery. Although trich is treatable, reinfection is common. Bacterial vaginosis is the most common cause of abnormal vaginal discharge in women of reproductive age. It occurs when healthy bacteria that normally inhabit the vagina become displaced by unhealthy species. It is clearly associated with sexual activity and often occurs after a change in partners. Symptoms may include vaginal discharge with a fishy odor and sometimes vaginal irritation. It's treated with topical and oral antibiotics. Pubic lice, also known as crabs and scabies, are highly contagious parasitic infection. Treatment is generally easy, although lice infestation can require repeated applications of medication. Because STIs can have serious long-term effects, people should be vigilant about exposure, treatment, and prevention. So one of the best things you can do is focus on education. Many schools have STI counseling and education programs, although, as I mentioned in the other lecture, that can depend on your state. These programs allow students to practice communicating with potential sex partners and negotiate for safer sex. You can build self-confidence and learn how to use condoms and other skills like that. You can find free pamphlets and other literature about STIs at public health departments, health clinics, physicians' offices, students' health centers, and Planned Parenthood. Easy to understand books are available in libraries and bookstores. Early diagnosis and treatment of STIs can help you avoid complications and can also help prevent the spread of the infection. If you are sexually active, be alert and seek treatment for any sign or symptom of disease, such as a rash, discharge, sores, or unusual pain. Remember, many STIs can be asymptomatic, however, so you should have professional examinations and testing anytime you have a risky sexual encounter or if you change partners. The only way to avoid STI exposure is to abstain from sexual activity. But since most people partake in sexual activities, you should choose to be safe and plan ahead for safe sex. Remember that you can ask questions and be aware of signs and symptoms that show that you care about yourself and your partner. If you are diagnosed with an STI, begin treatment as soon as possible. Inform your partners and avoid any sexual activity until your treatment is complete.